Hi, Dr. Sean here at Alaska Healing Arts Chiropractic and Rehab, and in this video we're going to go over some soft tissue techniques that would commonly be performed in the office for a cervical whiplash or cervical sprain strain. So let's go ahead and get started. The three muscle groups, really four muscle groups that we're going to be targeting with this is going to be the upper trap, levator and that connection, the SCM and the suboccipital muscles. So in the upper trap, really it's gonna be really gentle soft tissue. In this phase one of care, we're not gonna be really pushing hard on any of these muscles. We're not gonna be working really hard through them. We're really just gonna be working to get the muscles to soften, get your range of motion back, and get everything to calm down in this region. So we're going to be pinning the muscle down, putting a little bit of pressure, communicating with our patient to make sure that we're not putting too much pressure, and we're actually just going to use some nice gentle head movements to get all of that to relax out. We're going to be working through the levator, might be a little different head movement where we're trying to get more in line with that group of muscle fibers versus the upper trap. And then once we move on to the SCM, we would actually have to change the headrest position and go through that. But again, we would try to get that muscle to pop out a little bit. We'd grab a hold of it, we get it to lengthen and give us some nice range of motion through there. Sometimes we might actually just give some what's called dermal traction, or we might elevate the skin in around that muscle to give the nerves that wrap around that muscle a little bit of a breather. So we're gonna kind of go in through that in that same region, and then working through the suboccipital. So we're gonna add some pressure into that region of the upper cervical spine. We'll have the patient just gently tuck their chin and add a little more pressure into my fingers. Push back into me, there we go. And then we're gonna hold that for a little bit and we'll relax. We might put some pressure and find those tender spots and work on some rotation, some gentle rotation of the head and neck while we're going through those soft tissue techniques. And again, all of this is to get the muscles to calm down, the nerves in the head and neck to calm down, and just get that range of motion back so it's not so guarded, and that we can figure out how much of this is true injury versus a guarding pattern from the trauma of the accident. So that's an example of a common day one calm down soft tissue therapy that we would perform here at the clinic. If you have any questions, feel free to reach out and we'll see you guys next time.